Hello, and welcome to the Patterson Dental Podcast, a podcast where we discuss current events in the dental industry, highlight Patterson Dental priorities, and share insights on how to help our valued customers. My name is Leslie Ricken, Sales Training Manager here at Patterson Dental and host for the Patterson Dental Podcast. Thanks for tuning in.
You're in for a treat with another Strategic Accounts Takeover. Our guest host, Stacy Papp, talks with the folks over at MCDC. Enjoy.
Welcome to the Patterson Dental Podcast. My name is Stacy Papp, Strategic Accounts and Brand Manager for Patterson Dental, and I am so excited to be welcoming Dr. Deborah Brown to today's podcast. And I have to tell you guys, this is one heck of an introduction. She is the CEO of My Community Dental Centers and has been an advocate for public health dentistry for several years, playing a very pivotal role in the restructuring of Michigan's adult Medicaid dental program. She also serves on the Michigan Board of Dentistry. And since becoming a CEO of MCDC in 2018, Dr. Brown has been such a steward and champion of their mission to provide quality access to dental care for all, serving over 90,000 unique patients across a network of 27 centers throughout Michigan. Dr. Brown, I'm so honored and so excited to welcome you to this podcast, and we are so excited to learn from you about women in dentistry, the CHC space, and more importantly, the power of building deep relationships and what that impact is on everything from operations to patient care. So thank you for being here. I'm so excited to talk to you.
Well, thank you so much. I really am happy to have this opportunity, and I'm looking forward to a great conversation.
Yeah, so let's start with your journey. And I really want to get into this as much as you want to share.
Mm-hmm.
What has it been like growing as a woman in an executive position in the dental industry? And what has inspired you along the way to get into public dentistry and be a real activist in this space?
Well, let me start off first by saying, I took an unconventional path to dentistry. After high school, I went directly into the military because for me at that point, I was like, oh, I've had enough of school, and I really didn't see college in my future. I would be somewhat, as you might describe, a rebel. So I went against the grain, and my parents, they said, well, if you don't want to go to college, then hey, military sounds like a plan. So I spent some time in the military, and I came out. And as I was thinking about what the future holds for me, I did end up going to college a little bit later in life. I actually went to dental school at the age of 31, graduated at 35. So I was not your traditional dental student. And the way that I chose dentistry is an interesting story. I was a child who attended Head Start, and my first dental appointment actually occurred at Head Start. A public health dentist came to our classroom, and that's when I had my first dental checkup. Was at the age of 5 years old in Head Start. And wouldn't you know it, at the age of 5, I had 12 cavities.
Oh, my goodness.
Because I love to eat candy and things like that and sweets. And so my mom and dad had to start taking me to the dentist every Saturday for, it seemed like forever, but I believe it was just maybe a month. And so every Saturday I would go to the dentist and get some fillings and stainless steel crowns done by a dentist who I still fondly remember. His name was Dr. Haddon, and he was an African-American dentist. And that left such a positive impression on me at that age. And so later on, when I thought about what I want to do with my career and my future, I thought about Dr. Haddon and how nice he was to me and how I had never seen someone who looked like me as a doctor. And it kind of fueled my interest in wanting to go into the healthcare profession and specifically in dentistry. Our family dentist also played a part because he really talked about how he felt as a dentist, being able to help people and make people feel good about themselves. And he invited me to volunteer in his office and see what he does and to really understand how I could help my community. I grew up in the inner city in New Jersey and how I could be of service in a public health dentistry environment. So I really feel like this was not just a career for me, but really a vocation, a passion, and I continue to feel that way about public health dentistry.
I think it's probably safe to say it's your calling. That's
Yes.
something you were called to do. And at 5, hats off to Dr. Haddon, because I think any other 5-year-old would probably have been terrified to spend every Saturday at the dentist and probably even have a little bit of a response when Saturday rolled around, like, do I have to go again? Is it time?
Yeah,
what you experienced.
and not to mention the toy box at the end of the
Oh, well, of
appointment.
course.
So that always helps, right? But as I think about the other part of your question, as a woman, then I don't find many, I guess, role models out there. There's of course less women probably at the helm in many, I guess, careers, but especially in dentistry. And when I do meet one, I'm always, connecting with them, getting their contact information and trying to forge those relationships because I think we need guidance and open communication with those who are already in those positions. Or even right now, I'm mentoring someone from another organization that I connected with through Women in DSO. So I think really it's important to develop those types of relationships. I like belonging to professional organizations where I can connect with people so we can talk about our struggles, our successes. I think that's important.
Yeah, and I think our most important job as women is to lift each other up. And that sounds
absolutely.
You can't there's no more important job than to be the support of somebody else. And, whatever that looks like, I've got you sharing resources. So, I think thank you for doing that. I think that's something that's often overlooked, when you start to get in that space. So thank you for sharing that story. I knew you had an exceptional story, and I know we could spend more hours talking about your time in the military, but I do want to spend a little time talking about MCDC. So can you tell us a little bit more about MCDC, things like where you're located, what services do you provide, and really kind of tie that back to your mission and who do you serve?
Sure. So MCDC, we have 28 centers and they're all across Michigan, really. We even have 2 centers up in the UP, the Upper Peninsula. So we are a statewide organization and we consider ourselves part of the greater safety net where people who have difficulty in accessing dental care are able to find a dentist inside MCDC. We have comprehensive dentistry, so we serve all patients, we do all procedures, we even have done implants for patients. So we don't restrict ourselves to what we can provide or who we can provide for. But over 70%, I would say 70% of our patients do have some type of state funded insurance. So we do pride ourselves on being there for those that are underserved or have no insurance at all. We also have a wonderful hospital program that I'm very proud of because we know that many adults and children can't get care in a traditional dental setting. Maybe they, are autistic or have some other physical disabilities. And we see a lot of those patients in our hospital program. In fact, sometimes we're able to get them in before others in the community. So I'm definitely very proud of the work that we do in that program.
Yeah, absolutely. So this ties into the next thing I want to ask you. It's almost like you knew I was going to ask you this, but ever since I met you guys at the at MCDC, you and the team, it's very clear, and I hope for everybody listening that you are picking this up as we're talking about this, that the MCDC team leads with their hearts. I mean, I know business decisions have to be made, operational, tactical decisions, but it's always comes from a place, a heart center, right? So tell us more about what that means and really how that shapes those business operational decisions you make, as well as then what that trickle down impact is on the patients that you serve.
Sure. Our goal, we want to be the dental home for the entire family. And, our team members, they're a special group of people, and they really care about the communities and the people that they're serving. When I am out in an office, or you can tell how they care. They know people by name when they come in. They have a connection with the patients. Many of our team members, they live in those same communities. They see these people at the grocery store or, at Target or Walmart. And so they are very connected through the heart of those communities. And they want to make a difference. They want to support people and meet people where they are. Public health dentistry can be any type of public health, in fact, can be stressful, difficult.
Yeah.
But the passion does show through. And, I often get emails from people in the field just highlighting some of the things that happen and some of the patients that come back with, a tin of cookies or flowers for them, or just things just to thank them. Oh, you gave me my smile back, or you got me out of pain, and now I can go to work tomorrow and I don't have to stay home and take a day off, or just take a day off where I can't get paid. Just stories like that we hear every day. I mean, a lot of our patients, they have social barriers that they have to overcome. And the caring attitude of our team members, it could be the first bright spot of their day. I mean, they're dealing with so many things, transportation, maybe food insecurity, paying, housing, being able to pay their rent. And that smiling face, that person that cares about them when they walk into our centers, maybe that is the first time in that day that they were feeling supported or uplifted. I'm reminded, it makes me think about a patient that I had some years ago, and she had taken 3 buses to get to the appointment with me. She had 2 children in tow, one on each hand, looked like they were both under the age of 4, and she was late. And she apparently came to the front desk and she was like, "Oh my gosh, I know I'm late. The doctor's probably going to cancel this appointment, but I had to take 3 buses. One was late." I said, no, I will still, I'll still see her. I said, I may not be able to do everything in this appointment, but I'm going to get something done for her today. And that little compassion really made this woman's day. She just couldn't express to me more times than not how thankful and grateful she was that I was able to see her that day, because she wouldn't be able to get there. If I canceled that appointment, it would have been tough for her to get there again anytime soon.
Yeah, that's a heck of a story. I mean, I think 2 things. We often forget that there's a story behind the cover, and that's,
Mm-hmm.
there's a story behind of what someone is, we don't understand what someone is dealing with. So when they show
Mm-hmm.
up like this mother who probably was, a swirl of anxiety and feeling a lot of things, but to
Mm-hmm.
know that would wait for her, I think, if she would have probably fallen to her knees in the lobby in tears, you wouldn't have been
Mm-hmm.
shocked, because just that level of gratefulness. But I've even heard you say in the past that dentistry is more than just the mouth. And I think
Yes.
you've hit on that so much here, is that you are treating a human soul, right? You're treating
Mm-hmm.
a human being, whatever those insecurities might be, whether they're socioeconomic or they're aesthetic, or
Mm-hmm.
who knows what they are, financial, when it comes down to, being able to pay their bills. But,
Mm-hmm.
just knowing that someone that can say to them, I've got you, it's okay,
Mm-hmm.
really can often, kind of the experience you had when you were 5, that changed your
Right.
life. You've changed
Right.
somebody else's life, and not even knowing you've changed the trajectory of their life.
That's right. That's right. Because, sometimes, you could easily get involved in just doing the work. And
Sure.
we all, as dentists, we all know how to deliver the treatment. But behind that, like you said, is a person, and that person's needs need to be addressed also. They may have fear, anxiety, they may have um, something going on where you need to change that treatment for the day because they're under a stressful situation. So maybe you need to do something different. But there are a lot of things that happen at the appointment that take listening, compassion, and empathy, even with the busy environment that we're in. And um, I think that's one of the things that uh, we do well.
Well, and I think that dovetails into providing that quality dental care for all, that is your
Mm-hmm.
mission. That is something that's a cornerstone for you guys. And you can hear
Mm-hmm.
that in every interaction. Even
Mm-hmm.
the emails you guys send back and forth, even to us here at Patterson, there's just a quality to working with your team. And I think there's a misconception in the dental industry, sad but true, that quality around like care, products, services in that CHC space aren't really synonymous with each other. And I think you've done a beautiful job of disproving that. But could you talk about how MCDC further disproves that notion that quality and CHCs are hand in hand?
Sure. This is something that I've seen throughout my career. Um, there's a stigma sometimes associated with community health or public health in dentistry. And it's always assumed that you as a patient will find, poorly supplied dental offices, or, the reception area may be folding chairs, and, you won't have quality dentists working there. But one thing that MCDC, we pride ourselves on is having beautiful, comfortable, inviting centers. When I first came to Michigan to take this position as CEO, and I went to the centers, I was so impressed by the way they look, by the equipment they had. And I said, wow, if some people could see this, they would be amazed. Because, even though there's a stigma, there is some truth. There are some that don't necessarily, keep to the same standard, but we pride ourselves on making sure that we don't cut corners. We want to, of course, have the best, and that's how we work with Patterson in making sure that cost is important, but that we don't cut corners on the service we provide. So, as an example, we've had patients that walk into our centers and, they may say, am I in the right place? And, I hear this from staff all the time. And the staff assure them, you're looking for MCDC? Yes, you're in the right place. And a lot of times it's because they have the state funded insurance, and they're expectations are different.
Mhm.
And so that makes us feel good that, wow, we were able to pleasantly surprise them with, a beautiful center that is just as well kept and up to date as any private dental office. And then when it comes down to the services we provide, I'm proud of those too, because we make sure that we look at services that are done by both our hygienists and our dentists. We have a doctor quality assurance committee. We do audits to make sure that excellent care is being delivered. We have our dentists give us feedback on the different equipment that they're using, the supplies that they use. We often involve them in piloting maybe a new product that Patterson may recommend. So quality is at the top of our list. We believe in giving every patient the highest quality of care, no matter what coverage they may have.
Yeah, you said something in the earlier part of your response that kind of
Mhm.
stuck in my heart a little bit is that, those who might be on state funded insurance have a lower expectation
Mhm.
of not only the care, but also the facilities. And you really
Yes.
think about that. That's heartbreaking because it
Yeah.
shouldn't be that way, right? It should just be, you've got a problem. We're here to help you. We're here to make you comfortable and we're here to send you on your way. And I think we talk about quality and we talk about, the hard decisions that MCDC makes. And really what I'm hearing is the backbone is having great relationships. It's the great
Mhm.
relationships not only you have that your team has with each other, but that you guys then is an extension to your patients. And I want to get your thoughts on how important it is rather on building those relationships in the dental industry and maybe some things that you've done that you could share with others that are listening on really building those critical relationships or even deepening the ones you've already had.
Sure. One of the things that I tell others that I talk to, like my mentee, or just even some team members, or even my own direct reports, is that relationship building is a critical skill to have, no matter whether it's in your career, it's in business, marriage, whatever the case may be. It's important for living life. But as it relates to dentistry, I think it's important because you cannot affect change or serve people by operating in a silo. You need to see what other people are encountering and how they're dealing with it, and also be a resource for other people, and you can use them as a resource. I always like to think of life as something that can't be lived alone, and so you need to have others as your backbone, as your support. So I really like reaching out to my network for ideas, for connections or resources. In fact, I just reached out to Jill yesterday or the day before. I was asking her about some resources if she could send to me. And Patterson and Jill especially are always helpful in that way. And I think that's why relationships are so important to not only build, but to maintain. And sometimes that's the hardest part, is maintaining
Sure.
relationships, right? So
Yeah.
you have to, once you build that relationship, you have to maintain it. You can't just let it die. And I think that um, we're continuing to do that on so many levels.
Well, I think that requires a very heightened sense of trust, right? And I know that
Mhm.
you're talking about Jill Mulson, who is a wonderful
Mhm.
addition to the Patterson family. She's just a
Mhm.
fantastic person, but I think she also shares a lot of the same qualities that you and the MCDC share. It's that quality of care, no matter who you are, what you're doing, where you're
Mhm.
at, and it's just always providing you are giving part of yourself as well, not only a service when someone is in
Mhm.
your chair, but it's also, they're probably telling you things as much as they can in a dental chair, of course, but they're
Yes.
telling you things that, sometimes you wonder, like, wow, they really just kind of, left it all on the field for me today. And they needed to get that out. But I don't think you guys would necessarily sit back and have the award of the day and say, let me tell you about, the therapy award that I had and here's what I was able to provide. So, I mean, I think there's just so much silence when it comes to you're providing them so much care and you're building that relationship, not only with the patient, but also your vendors and your business partners, that then does trickle down to your patients, and then they walk out the door happy, your team is happy, you're happy, and then we start the day all over again. So I think there's something to be said about what you just mentioned. You can build, but you've also got to put a lot of focus on nurturing and a lot of focus on just making sure that the well is full. You got to keep it that way.
That's right.
So speaking of relationships, I know you've worked with Patterson for a long time and you've really developed those deep relationships. I mentioned Jill earlier with the team over time. Tell us more about your partnership and really how that's been more than just transactional in nature.
Sure. And it's definitely more than a transactional relationship. This relationship has grown from the time I started in 2018 and has grown progressively stronger. I mean, it means a lot that I can pick up the phone if there is an issue going on, and I can reach out to somebody, send an email and know that they're going to answer me back. I've worked with many different dental suppliers, but I would say, and I've said this to Jill and others on the Patterson team, that they've truly been a real, in the realest sense of a partner, a support, not just a vendor. And sometimes, the term vendor just implies this transactional type of relationship. And so that's why I don't even like to refer to them as a vendor, because they have truly partnered with us. They want to know what our goals are. They want to know what we need to be successful. Everyone on their team that I've come into contact with has a caring and responsive approach to what we need, what we want, and what will help us to achieve our goals as an organization. There's a lot of dental experience on their team, not just from the supply side, but they have a lot of dental industry knowledge on their team. And so that's very helpful for us when other things come up outside of just supplies, that we can reach out to somebody on their team that either has that knowledge or can connect us, to other experts in the industry.
Well, yeah, you said it's more than just supplies. I think that you hit the nail on the head with that one, and that's exactly what it is. It's more, becomes more of, again, you're keeping that patient in mind, and there's a whole process before it gets to that patient. But at the end of the day, it's all about patient care. So I wanted to talk a little bit about how Patterson has helped MCDC uphold their mission of providing quality access to dental care for all.
Sure. So, I mean, in order to provide care, some things that you need to have supported from others around you. So in order for my people in the field to deliver the care they need, I need to provide them with the support and supplies and things they need. But we also need that type of support from our partners, such as Patterson. So things that they do for us, like just a couple of weeks ago, or maybe last week, we had a team meeting and we were able to use a Patterson facility here in Grand Rapids to have that meeting. Nice. And so, that's very, very helpful for us. They support our doctors' CE program. We have an in-house CE program that we do, and Patterson makes a yearly donation to supporting that, so we can have our lunch and learns with different speakers throughout the year, and we provide our doctors with some CE credits, and they're often proactive about making recommendations for us on different products that come out. So we don't have to think about looking in industry magazines or trying to find out what's out, they proactively look at these things and they say, hey, this may be something that you guys want to look into. Do you want to get some samples and try it? Or it may be a service that they might recommend that is out. I mean, one of those that I can think of right now is the MSDS portal that was brought to us as an idea, and we took it on because it streamlined not having those great big books in each of our centers. So now, so now we have the auto SDS, and so that's how they help us uphold our mission by being proactive and thinking ahead and partnering and supporting and all those great things that help us to deliver care and not have to worry about some of those things on the back end because they're there for us. And so it's really a win. It's a win for MCDC to be supported like that.
Well, this is probably one of my favorite questions to end with, and it's the crystal ball question. So if you had a crystal ball, what does the future of public health dentistry look like in the next 10 years?
Well, first, let me say I really wish I had a crystal ball because I would be picking the next Powerball numbers. but if I had a crystal ball, I think we need to continue to evolve in public health dentistry. I think we may need to adopt more technology to get things done more efficiently, not just on the patient delivery side, but on the revenue cycle management side, even the support side through payroll and things like that. I think we're going to have to learn how to do things in a more efficient way, especially with certain things being at risk, with coverage for certain patients. I think AI is definitely here to stay, and we're going to need to adopt AI more in public health and just dentistry in general. Scanning technology, definitely. I think in the next 10 years, you won't even see any more. You won't even see any more traditional impressions. You're going to see all scanning technology. And I think we'll need to be creative in how we address continued workforce challenges. Not enough young people are choosing dentistry as a career option, whether they be dental assistants or dental hygienists, or even going to work at the front desk in dentistry. So I think we're going to see a lot more creative options, like creating your own pipeline training programs in within, say, like MCDC, especially dental assistants. That seems to be the biggest gap right now, and I think it will continue. And then I also think we're going to see more oral health policy changes coming to the forefront, continuing to develop dentistry as an essential health benefit versus being optional. Some people may have medical insurance through their job, but they may not have dental, or if they have dental, it still only covers that traditional $1,500 that has been set for many years now, probably ever since I can remember. And so I think you're going to see a lot more policy change advocacy going on, especially also with seniors, because we know traditionally Medicare doesn't traditionally cover dental, but they do have some Medicare Advantage plans that do. But I think we're going to see a lot of movement towards oral health being included in overall health. We've been slow to do it, but I think over the next 10 years, we're going to see a lot more of that. And I'm hoping 10 years from now, we're going to see that some of my predictions work out.
Well, you can listen back to this in 10 years and just make a checklist to be like, I was right. I was right. I was right.
Yes.
I mean, it's all good stuff, right? But it's all, stuff that you think too, like we should be doing that in leaps and bounds today. So hopefully, you can kind of get on the faster treadmill of what that public health dentistry looks like and be able to do more of what you and MCDC are doing in order to take care of the people that live in their local communities. So thank you for sharing your thoughts on that. Again, I'm with you on the Powerball. So if you find it and you pick it, I'll happily get in on that one with you. But I do want to thank you so much. It was such an incredible experience to spend time with you today and really to learn from you. You really are a pillar in the industry, even though I know you would never say that about yourself, which is one of the many wonderful things about you, and someone that people look to as a North Star, really living that MCDC mission and taking care of not only your team, but your patients and your community. So thank you for spending time with us today and sharing your story. It was truly an honor.
I really want to thank you for having me. And you're right, I wouldn't really
I know
look at
you would.
myself as a pillar, but I hope that I can just make small changes as I continue to do what I do every day. And if I can, just impact one person, then I would have done my job. So thank you. I'm grateful for the opportunity to share not only my story, but MCDC's story. And I appreciate the opportunity so much.
Absolutely. We would love to have you back. So for those listening, to learn more about Dr. Brown and her team and the exemplary care they provide, visit www.mydental.org. And we will be back soon with more compelling stories, insights, and wisdom from the DSOs and institutions that take care of our smiles.
Thanks for listening to the Patterson Dental Podcast. That concludes this episode of the Strategic Accounts Takeover with guest host Stacy Papp. Tune in next time.